Hi, I'm Dr. Babar Ahmed. Welcome to Health Matters KC, where we discuss a healthier, stronger, and more mindful you. Behind every cancer diagnosis, there's a life that just changed forever. And at the heart of that journey, standing between fear and hope, is the oncologist. In today's episode of Health Matters KC, we take you inside the mind and heart of the people fighting cancer, not just in the lab or in the OR, but in the clinic, side by side with patients day after day. I sat down with Dr. Mahmoud Hashmi, a dedicated oncologist with years of experience treating patients and families in their most vulnerable moments. We talked about the science, the evolution, and the future of cancer care. Whether you're a caregiver, a medical student, patient, or family member, or just a curious mind, you'll walk away from this episode with insight, perspective, and a deeper appreciation for what cancer care really looks like. Hello, I'm Dr. Babar Ahmed here with Dr. Mahmoud Hashmi, a hematologist-oncologist for over 20 years and has seen hundreds, if not thousands, of patients. And he's from Stormont Vail Hospital and really honored by his presence today. So, Dr. Hashmi, really appreciate you being here. Thank you so much for your time.
Thank you for inviting me. It's my honor to be part of this.
Yeah. So we're just going to start right into it. And I know because cancer obviously is one of the biggest topics out there. At a cellular level, what would be the root cause of cancer?
Basically what cancer is, our body is made up of a lot of cells, like millions and trillions of cells. And every day new cells are being produced, they grow, they do their function, and they die. And this is a very finely tuned mechanism. And any time anything goes wrong with those cells, it got deleted.
Sure.
But sometimes something goes wrong due to different factors. And either we start making more cells than what we need, and then they don't grow properly, they don't mature, and they don't die at the time they need to die. And that's how we end up with a lump of cells which finally start taking over our body and taking our resources. So that's what cancer is all about.
Okay. So which ones do you think would be considered like the most aggressive or the most deadliest in men and women?
So we will put it in different ways there. What I will put it is the most common cancer in men is prostate cancer, and in women is the breast cancer.
Sure.
While the second most common cancer is lung cancer, but if you look at the mortality rate, that more people will die of a lung cancer than the breast or the prostate cancer. So in terms of disease burden, these are the common cancers.
Sure.
But on the other hand, there are some cancers where we do not have good treatment options or limited options. They can behave more aggressively, and we may have a more mortality with those cancers despite they have a low volume, like pancreatic cancer.
And what would be, let's say, if you're just a middle-aged person, what would be some of the red flags that you think people should be looking out for, whether you're a female or a male?
Definitely, the red flags will be, body has certain ways of telling us something is wrong. Like for example, pain is the most important instinct we have.
Yeah.
If we start having some pains which are unusual, they're progressing, they're getting more intense in the intensity. Those are the things, the new pains, more intense, more frequent, we need to worry about it. Similarly, we are having shortness of breath, or we are losing weight unintentionally. Some of these symptoms are the things. So body has certain or unexplained fevers. So these are the things which we have to look for. And if unusual, then seek advice with your doctor.
Yeah. So when it comes to, let's say, family history, how much of an importance or risk factor is family history when it comes for cancer?
Sure. Family history plays a major role, I will say important role there. Although 5% to 10% of cancers can be hereditary, while 90% of cancer happen on their own. But knowing family history is very important. Like for example, breast cancer, sometimes it can run in the family. So if multiple family members have breast cancer, especially at age less than 50, we need to be watchful on that. Similarly, prostate cancers, ovarian cancers, and sometimes the colon cancers that runs in the family. So these are the things which we have to always look for, and but not all cancers are hereditary.
Yeah. But now, what if the family members, like how direct of a family relative do you have to be? Because sometimes, like even in the clinic or in the emergency room, patients will come in and say, oh, my uncle's mom's nephew's husband had the cancer diagnosis, so I might be at risk.
Depending on the type of cancer they are talking about, as well as how close they are. Like for example, in a colon cancer, there is a syndrome called Lynch syndrome, where 3 generations can be affected with 2 first-degree relatives, and one will have a cancer at age less than 50 or so. Similarly, multiple family members with breast cancers, ovarian cancers, the risk of breast cancer is there. So it all depends on cancer by cancer basis, as well as different guidelines are there. So if somebody has expressed their concerns, we have to seriously look into it, whether they are eligible for any genetic testing or not. And then we decide on that.
So it kind of depends on the type of cancer?
Depend on the type of cancer.
Okay, all right. So then why do you think like the cancer rates are rising? Like what would be the main root causes for it?
Sure, there are different reasons. One is we are detecting more cancers because we know more about it. So we have better screening tools. We are detecting them in earlier stages. We have more awareness, so people are getting a screening done. So that is one of the reasons that we find more cancers. But on the other hand, the other factors which can really impact the increase of the cancer is aging. As we all get older, we have more chances of getting a cancer. And now with the recent medical science advancements, people are living longer. So that is the reason age is the most important factor. But many other factors like smoking, environmental exposures, obesity, sunlight exposures, those are the other things, lifestyles, that can affect or is increasing the risk incidence of cancers.
You have mentioned lifestyle and like environmental toxins. So first thing that comes to my mind would be like, especially for kids, would be like vaping. Smoking was always there, but like you have vaping, then you have alcohol. Is vaping a big risk too for cancer?
Sure, yeah. Any tobacco products make multiple toxins in it. Like for example, cigarette has about 70 toxins in it. Similarly, these other products like cigar or electronic products, they all have certain levels of toxins in it. So they are not they are as bad as cigarette smoking.
Okay. And then in your experience, like which countries in your knowledge have like the least cancer versus the highest cancer? Like what are the relations between them?
Sure. This is the most complex topic to understand because where the countries which are more advanced, they have more resources, so they can detect cancer more. So advanced, educated countries with resources have more cancers, like Australia, US, UK, European countries. While if you look at some WHO data, in African countries, we will see much less cancer. But the problem is, not all the data is well documented. Only 2% of population have access to data and all. So that's why if you look at WHO, Niger or Sudan will have a least cancers in those countries. But there are some confounding factors. But also we need to see, although this is a factor, but still we should see, is there any particular environmental, dietary or other factors which puts one kind of population more at risk than the others. So that's how we look into the data.
And it could also be because of, like you mentioned, the lack of technology and the resources there, they may have the cancer, but it's not getting diagnosed. Or they're not finding it on autopsy or whatever. They might attribute it to natural causes when actually they had a cancer diagnosis or a hematological diagnosis.
Or it's still a possibility there could be some other environmental factors which are not well defined yet.
Okay. So, and in the countries where, let's say in the developing countries, is there any main factor or factors that you see that would cause, like you've seen any kind of correlation as to the low rates of cancer?
Again, nothing particular, but again, the access is the most important thing. If you look at it worldwide also, the cancer incidence is going up, even in underdeveloped countries. And similar types of cancers, like you will see breast cancer, lung cancer, or prostate cancer, but also sometimes in underdeveloped countries, cervical cancer is more common.
Yes.
Because of some resources and other factors.
Yeah, because I know one thing that comes to my mind, like especially they mentioned certain like Mediterranean areas. I think it's like a small island off Italy, Sardinia, and then Loma Linda, California, and a place in close to Okinawa, Japan. Like they follow a specific type of diet and a lifestyle, and in them they found that their life expectancy is very long and their cancer rates are extremely low compared to other.
Exactly. So there are certain, definitely your lifestyle do impact your cancer risk there. If you are active, you're exercising, that definitely helps you decreasing the obesity, and then obesity is one of the risk factors for the cancer. So that's one factor, and also sometimes the diet they are consuming.
Yes.
Less processed diet, or diet based on more fruits, vegetables, grains.
Yeah.
Those factors instead of more processed or refined sugars. So that also impacts there.
So you have brought up diet. So like, is there any kind of diet that you would endorse? Like that's out there right now?
There is no particular diet we can endorse, but the main thing is healthy, balanced diet is the most important thing.
Okay.
So if you divide your diet into 100, like your plate into 100% portion, 50% should be vegetables and fruits.
Yep.
30% should be carbs and 20% should be proteins.
Okay.
While your fruits and vegetables, should be more the color they have.
Yes.
Like greens and oranges and reds, they are beneficial for you.
Sure.
While in the carbs, if you're getting your carbs from from legumes and all, those are healthy ones.
Yeah.
While the proteins are more like poultry, fish, nuts. There you can still eat some other meats and all, but moderation and balanced healthy diet is the most important thing there.
Yeah. So we were just talking a little bit before about like technology and then resources too. So then for the countries that do have the technology, what would you say to someone that just came up and say, hey, why don't we just do CT scans or MRIs every 6 months and just find any tiny spot in the colon or breast, pelvis, and let's just get rid of it?
It's a good question. So to find a cancer, or what we call it is screening, it has, for a test to qualify as a screening test, it has to fulfill certain requirements. One, good technology should be present. That means chances of test is positive but cancer is not there. That is true positive. So it's a sensitive test is required. Secondly, if we find something, what are the risks of doing biopsies and other things there? What are the risks of treatments? And finally,
it may lead to like unnecessary testing, procedures and stress and finances.
So it's a very stringent criteria for any screening test to be qualify as a screening test. Otherwise, we will do too many tests, which will put patients at a risk of false positive results.
Yes.
As well as unnecessary testing and their risk, and also the financial toxicity, and ultimately it will impact the whole healthcare system or the whole country.
No, because I know I've personally just known some people when I was doing clinic too. It's like they would, if there was like a female, they found out like a cyst
Sure.
and she panicked. And she would go to a radical procedure and said, "Oh, I'm doing a mastectomy. I'm not taking any chances." And you're like, "Wait, this might just be a benign issue. Why are you doing such a radical procedure?"
So definitely understanding the benefits and the risk of test is very important. But fortunately, 50% of cancers, which are most common, we have good screening tests there. So if we follow those screening test guidelines, we will be still able to find more than 50% of cancers at their early stages and can make an impact for the patients.
Yeah. And right now, kind of moving on towards like for cancer treatments, what would you say is the current state of cancer treatments based on, let's say, 10 years ago, 20 years ago?
So this is a very I will say a lot of advances has happened, and this is a good time where we are finding many more treatments. So this is a much better, we are at a much better place than what we used to. We have multiple modalities of treatments available. It's still the traditional chemotherapy, surgery, radiation therapy, but more importantly, new generation immune therapies and targeted therapies has changed the landscape, and patients are living longer with better quality of life. That means less toxicities, and they are doing things what they want to do.
So like based on like traditional chemo treatment versus the immunotreatment you alluded to, so what would be, if you could just explain like in a layman's terms, like what would be the main difference between the two?
So the chemotherapy is like a chemical which directly attacks your cancer cells.
Okay.
While immune therapy, just like our body tries to fight the infections and many times is able to fight the infection, same way body is trying to fight the cancer. And our own immune system keep the cancer in check for a certain period of time. But unfortunately, at some point in time, cancer is an evil or a smart enemy, and it overcomes our own immune system.
Yeah.
So, and then the cancer grows. So especially last 10 to 15 years, immune therapy has made huge differences in the responses to the treatment as well as quality and quantity of life of the patients. So what immune therapy is doing is it's going in there and enhancing our own immune system, which is deactivated by the cancer to attack it. So it again helps, either it works alone or sometimes it helps the other chemotherapy and radiation to achieve much better results.
So it basically doesn't affect your bone marrow that much. It's less toxic on the bone marrow.
Less toxic. It has its own toxicities, but much better than other traditional chemotherapies, which still have their role. Sometimes we have to combine.
Sure.
But it's a addition to our resources to control and cure the cancer or treat the cancer.
Okay. So since we're talking about treatment right now, I'll be like devil's advocate, because I know there's a lot of people who think about this and they have it on the back of their minds that how come there is no cancer cure yet? There are chemo treatments, but there is no cure. And then a lot of people come up with different conspiracy theories about it, that it's the pharmaceutical industry, they don't want people to live, and this is a global conspiracy, the Illuminati, they want to control the patient population, that's why they haven't come out with a cancer cure yet. So what would be your response to that?
Definitely, we respect everybody's opinion or thought process, but overall, the cell biology or how the human cells and body works is highly complex. There are hundreds of pathways or chemical pathways within the cancer cells. And sometimes we try to control certain particular pathway and some other pathways get more activated and cancer figures that out. That's how we develop resistance to the treatment. So it's not like there are many cancers which we have achieved deep remissions or cures. Like for example, testicular cancer in young men. Many other lymphomas, some leukemias, early stage breast cancers, early stage lung cancers, colon cancers. A lot of them are in deep remissions or long-term survival is there, that patients are living many years to come with that. But still, if the cancer is in advanced stages, then we have challenges with that. So I don't think so it is any bad intention on any other part. Hundreds of scientists, hundreds of humans are working day in, day out
Yeah.
to help the humanity and improve their quality and the quantity of life.
Okay. So there is no conspiracy theory?
No, no.
Okay. All right. Now, it's one idea that just popped in my mind. Like, so now with a specific example that I have in mind, because I sometimes have a little issue with that too. Now, in my knowledge, the only cancer that's preventable is the HPV, cervical cancer, with HPV vaccine.
Yeah, so definitely at this point in time, HPV vaccine is available.
Yes.
So we can, if the teenagers are getting vaccinated,
Yes.
then we can eliminate the cervical cancer
Yeah.
and few of the HPV related cancers. But still, if we cut back on the smoking and some other risk factors, we can still improve and make an impact for other cancers. And we have. If you look at the 1950s and 60s, where the smoking rate was highest, cancer incidence was going up. But now, as people are cutting back on the smoking or stopping, you have seen the impact on that.
Yeah. So going back to the HPV, because I know sometimes it has a little bit of an ethical, moral dilemma too, because some people who are more on the conservative line, they think that if you're giving my 11-year-old or 12-year-old daughter or son this vaccine, you're promoting sexual promiscuity.
Sure.
Also stating that, of course we know that this can prevent cancer, but then what would you say to those patients or those families that feel reluctant or hesitant in doing that? Like, hey, I don't want to give, my child's only 11 or 12 years old, why am I going to give them an HPV vaccine?
Sure. So I understand their concern, being a parent myself. And then when the vaccine came, a lot of my own colleagues were asking me what you will do. And I said, no, I will give vaccine. First of all, that this vaccine is given right at the same time with many other vaccines are given to the kids. So kids usually do not have that much of an understanding of the situation on these factors. And on the other hand, as the kids grow up and once they are reaching to 18 or in adulthood, you can guide them, you can teach them, but you cannot totally modify their life.
Exactly.
So I do not think so, and this is my personal opinion, that I do not think so. Giving a vaccine, we are giving them a permission to do everything what they want to do. But it's our other teachings, education, that matters most. And having the protection, and also other factor is they could be in relationship in future that person could have HPV.
Exactly, that's true. So it's not only about you; it's about the other person too. Because it's not just a female vaccine; it's for men as well, for boys and men.
So it could be.
Yeah.
So these are the factors there, but I understand the challenges. But my sincere advice will be that it's better to give than not to give. But at least definitely parents know their kids well. But that's what I will support, because I have seen head and neck cancers, cervical cancers, and I have seen young patients or young people dying of this cancer. So it's better, and that in fact impact the whole families, or they have small kids. So I think it's better to be vaccinated than not.
Now, kind of going off a little bit now, people and patients who are immigrants who have never experienced cancer before in their family and in their circle, and they don't know the system here well. I'm sure you've come across those patients as well. So what should they do if they or their loved one gets diagnosed with cancer?
Sure. The most important thing is definitely having a good primary care physician. So that's the entry point into the medical, health system, and having a good insurance is very important. And once they are diagnosed, then they get referred to the oncology physicians, and then we are most of the oncologists are very respectful and mindful of people's cultural needs, religious needs, and all those factors. So knowing the cultural awareness of them, that's very important for the oncologist. And then there are several resources available, like social workers, case managers, at different levels are available. American Cancer Society provides a lot of support. So there are a lot of resources available. So having a good insurance and having a primary care and access to health, that's the most important thing.
So are there resources for patients, let's say if they don't have insurance or they're immigrants and they have this diagnosis, what what can they do? I know it can be frustrating.
Definitely, it is very challenging.
Yes.
Although there are certain safety nets or some health access or charities there which can help, but cancer care is very expensive. So there
Yes.
are certain medication assistance programs and all that, but that do not cover everything. So
Sure.
having then again I repeat, having a good proper insurance is very important.
Yeah. So you had mentioned like a team. So in your practice, like who is a part of the whole cancer team?
Sure. So cancer is usually a multidisciplinary approach. So usually you can say the oncologist is your main anchor, and then we use, so oncologist is a physician who treats the cancers, and then we have our especially trained nurses, nurse navigators, chemo nurses, radiation oncologists, pathologists, interventional radiologists, oncological surgeons, as well as we have a specialized palliative care team
Yes.
who work hand in hand with each other to deliver the care, because cancer care is a very long journey, and at different levels you need different help. So it's like we all work together to provide the care.
And a lot of times when patients have like a diagnosis and they may not be having the outcomes that they wanted, and they want a second opinion, and then they'll go to MD Anderson or Mayo Clinic. So when should people consider getting a second opinion?
That's a good question. So to be honest with you, these are desperate times. If any time when patient feels that they wanted to have a second opinion, we always support that. It's nothing of a matter of ego or getting insulted or anything. Many times patients go there and have the same kind of treatment, or even if it's a different opinion, then they can coordinate with their local oncologist, because sometimes it's not easy to travel with cancer care every week, every 2 weeks to get the treatments. It's expense, physical stress, and all those things are there. So that's the thing. Also, sometimes we are running out on options and you are looking for any clinical trials, and that's the time definitely we send. But we never mind if patient ask ourselves that we want an opinion. We encourage that, because that is the safety or like satisfaction of their heart and mind, and it also helps them as well as us, that if they are saying the same thing, or MD Anderson or Mayo is saying the same thing what we said, that reassures them, and it enhances the bond and the relationship between the doctor and the patient.
Now, in my like palliative practice, and I've noticed like sometimes patients will go to Mexico, they'll go to the Caribbean, or they'll go to Turkey, and they'll seek out these types of experimental treatments, or because of cost, whether it's due to medical tourism, or there may be an oncologist out there that is giving them or supposedly providing cancer treatment that can't be done here. So what will you say to that? Like how can the patients tell like if these places are legitimate? Like what would be some red flags in that?
So personally speaking, I don't have too many of those patients that in my own experience, once a while I have those kind of situations. But I will always recommend, make sure, do their homework, look at who is providing the care, what is their reputation, what they are, what kind of treatment they are providing. And then also double checking with your own country's embassy or State Department and all that, to know is this not some kind of a scam or anything, that we do not want people or our patients to fall into that. So I will say be careful, do your homework, check with your doctor. If you find something, check with your local doctor, see what they feel like, and go from there.
Now, a bit ago, we were talking about like prevention. So one of the, I don't know if it would be called latest, but one of the practices or rituals that they find that can help with cancer is like fasting. And as you know, fasting is part of many the Abrahamic and non-Abrahamic faiths, Christianity, Judaism, but it's also part of Hinduism and Buddhism. So what's so special about fasting that decreases cancer?
Sure. So this is some evolving concepts there, and some research is going on. Some early research do mention that, again, depending how they define fasting, because in those intermittent fasting, there are different ways they did the fasting. So there is some concept that by doing that, your body, like when you are in fasting, body has more time to concentrate on getting rid of cancer cells or dead cells and all. So those are certain concepts being evaluated at this point in time.
Yeah.
But we have to be careful, like especially sometimes cancer patients are going through treatment, they are undernourished or under nutrition, and at certainly,
and if they're fasting on top of that,
they can become hypoglycemic, or their blood sugar level goes down too low. That could be dangerous. So this is an evolving concept. It's an interesting concept that many scientists are looking at it. A few years ago, New England Journal has published an article about it. So that helps, but it was more of a general health also. Definitely, if you lose weight, your obesity improves, your blood pressure improves, less chances of diabetes. So those are the factors.
What I was reading, it's like, in a way, it's they call it starving of cancer cells.
Sure.
It just basically cuts down, I think, their metabolic rate and their growth, and it leads to what they call apoptosis, with the killing of the defective cells, and your body's own natural responses or ways of handling defective cells.
Exactly. So those are some interesting concepts. The scientists are trying to look at it. So that's important. But again, totally depriving, not eating the carbs at all, that's not technically possible.
Sure.
In that situation. So, like again, healthy carbs, whenever they are eating and all, healthy carbs are important there also.
So, and just hypothetically speaking, like if you could, which would be like the one main cancer if you could wipe out completely? What would be your number one target? So
my wish, my hopes, and my prayers will be I get rid of every cancer. So that's the thing. But it all depends, we have to be very realistic. Definitely any cancer that we can modify our factors there, like smoking, lung cancer, with smoking and many other cancers. I think that's what I will say.
And then in your practice, what would be like your biggest frustrations or hurdles that you see that you deal with on a day in, day out basis?
Definitely, sometimes healthcare cost is up, and a lot of other insurance things. That is the factor there.
So why is that though? Because it's like, I think, can't remember the guy's name, but it had nothing to do with cancer, but there was an HIV medication out that cost like almost pennies. It was so cheap. And then he just decided to make it, I'm going to make it like $50 a pill or something. And I mean, it was all legal, and like nobody in the government could touch him. He went to Congress and testified. But it's like when we hear this, it just drives us crazy. Like, the guy is not doing anything illegal, but it's just driving up the cost. Like something that was so cheap has become so expensive. So it's just very, very frustrating if you're a patient. That why is it a life-saving medication so expensive?
Definitely, this is a very complex question there. Definitely, there are multiple factors there. Sometimes the research, they put a lot of resources in finding a drug. So sometimes they are trying to maintain that. But I agree with you that some of the medications, available at a cheaper cost can help a lot of patients.
Now, just kind of going with you personally, like how do you disconnect from your practice and then your personal life? Because you see so many cases of cancer, and I know it's not a very uplifting field. I mean, it can be, but then obviously it can be extremely difficult when you've been seeing these patients for months, maybe not years. So how does this affect your personal life? So
definitely, the important factor is the patients become part of your life. That's what is important, and otherwise you can't. I think when at this point of age and it's patient become the part of your life basically. So but exactly that's what we teach the patients or educate the patient, that is applicable to us also. That sometimes you set the smaller goals and get the happiness in those goals. Like for example, if your patient wanted, I know life expectancy can be limited, but her goal or his goal is to attend the graduation of his kid, or a marriage ceremony of their daughter, or a certain particular personal vacation, or certain goal in the life. When those, you can't set multiple years goals, but you try to set short-term goals. And once your patient achieves those goals, that gives them the happiness and that gives you the happiness. So that's how you go on day-to-day basis with your life. Definitely when you come back home, you have responsibility towards your kids and family. So you try to balance that, like work-life balance. But frankly speaking, to shut your mind off completely, that these are not two different worlds. They're part of your life, family, and at some point in time, some of the cancer patients are coming to you for 9-10 years. So you become the part of their family and they become part of your family. So to separate them completely, it's impossible. They're part of your life.
So, I mean, a part of your life also being faith. So then how do you see, like, what kind of role does faith play in your practice or attitude towards cancer?
Sure. Faith and spirituality is very important in cancer care. If you look at it, even United States, if you look at some data, 90% of patients do believe, or 90% of people believe in God and some other forms of spirituality. So having that higher sense of connectivity and peace and the purpose of life is very important. In our lives are mortal. One day we all will be going, and our death is a process. It's inevitable for us. It's sad, definitely, but it's part of our lives. So the important thing is what I noticed or learned from my patients, the patients who are satisfied with their life and they feel like they are at peace, they have an inner peace, that's very important. So although spirituality is a more broader term, and then different religions also part of it. Okay, so it's very important. People have more positive outlook of the disease. They handle it much better. Even people who do not believe in God, or they have some kind of a spiritual sense in them, or
because they may not necessarily believe in God, but they usually still believe in some being that's out there.
So as an oncologist, our responsibility is to respect each and everybody's faith and their spirituality. And actually many patients, if you look at some data, many patients want us or the oncologists to address their religious needs and spiritual needs. Although many cancer patients, we have like inpatient religious services or outpatient religious services, and then involving the community faith leaders in that is very important. Because sometimes those are the leaders who are well educated how to handle the stressful time according to the spirituality and religion. So but as an oncologist, it's our responsibility to address that and respect that part of it.
No, recently we spoke to Dr. Katie Harry. She's an oncology psychologist from St. Luke's Medical Center, and we had a decent conversation about that. She explained that very similar to what you were saying, that the belief system of a person, if they get afflicted with this cancer diagnosis, how meaningful it is for them, and it actually improves their outlook. They have a better support system, and the faith really provides a lot of guidance and just gives them a peace of mind.
No doubt about it. Most of my patients feel more satisfied, and just definitely we are all humans. At some point in time we could have some distrust, or and negative thoughts can come.
And that's what we talked about too, is like we were talking about, like if patients, they come into practice, that they may feel like they're being punished by God for this diagnosis. Like, how do we navigate around those conversations?
But take that as also in a way that at least even when you are having a negative thought, you have some relation to that, that concept.
That's true.
That's why you are having a negative thought also. So in that place, a well-educated, well-trained religious leader can guide us that how to overcome that negative thought. What is the other aspect of that? Just like, like when a kid is unhappy or hurt, he usually cries and he will be upset with mom, usually with the mom or dad, and he will complain, he will be upset. But if you go deep down, there is something, the relationship is there. So that's what you have to channelize that.
Yeah. And I know there probably been so many patients in your career. Is there any one patient that you think that kind of stood out that you still think about, like what was most memorable or like the most difficult type of a case?
It's hard to say. It's just like, like when you are a mom or dad, you love your own all kids equally. It's exactly like that. With each patient, you have a relationship and you love them, you respect them, and you learn from them also. But there are a few things which I will remember. The first one, my first rotation in oncology when I was a very young doctor, that changed my mind to become oncology, was a young woman with very small kids, and she has a terminal cancer. She was fighting for many years, and there was not much left. But at that time, still she had this fighting spirit for her kids. She wanted to live for her kids. So that is the point. I feel like that generates my interest in oncology. And I said, if this lady who is willing to fight, why not I be the part of that fight? So that was one thing. And secondly, I remember one of my patients, I was out of town for a conference, and she, definitely she was getting closer to her dying process. So, and then definitely she wanted to see me, and I was back from the conference, and I was traveling back to the hospital. And then I reached there, all family was sitting there, her husband, kids, mom, dad. And she opens the eyes and she says, you made it, you came. And that was her words. And I think after a few hours of that, she passed away. So that matters most.
Oh, wow. So, and in the future of cancer, how do you feel about the future of cancer treatment?
I'm very optimistic, I'm very hopeful. Actually, 25 years ago when I was getting into this oncology, or I was doing my internships and all that, one of my mentors told me, Mahmood, you are entering the oncology in a very good times where we can do a lot for these patients. We have struggled a lot for last 50, 60 years. And I have seen in front of my eyes things have changed. The targeted therapies, the immune therapies, better imaging modalities, better surgeries, less invasive surgeries, robotics. Things are improving. So I'm very hopeful, very hopeful. There is no looking back there. Things will be much better.
Now, a thought that just came to me, we were talking about future of cancer treatment. So everybody's on the AI bandwagon right now. So how do you see AI affecting cancer treatment?
Sure, everything has its positives and negatives in a very early budding stage right now. So we have to be carefully understanding the benefits. Definitely any technology, when you harness it properly and use it properly, it is for your benefit. But if you do not use it properly, then it could harm. So definitely it has still to go through a lot of evaluations. But for example, reading some radiology scans, AI can help better. Some treatment pathways, toxicities, evaluations, AI can help in that. Checking the interactions of different medications to minimize the toxicities. So every technology has its place, and AI will have a place, but will it replace the human mind? I have doubt. That's my personal opinion.
Well, any final parting thoughts? Anything you'd like to tell the viewers?
Sure. So I will say life is very precious, and we don't realize it till some kind of major event happened to us. And in that, what I will say, whatever life, whatever day we have, enjoy, help others, try to live that life, helping others and loving each other, cherishing each other. I think that gives the meaningfulness to our life, and ultimately when we reach to our final destination, that helps us. On the medical aspect, I will say please get the screening done, like for breast cancer, colon cancer, if you are a smoker, lung cancer screening, skin screening, prostate screening. These are the major cancers. We can detect them in earlier stages, and if we can find them early stages, we can really make a huge difference for the patients, their quality as well as quantity of life. So get it done and live a healthy life.
Thank you so much, Dr. Hashmi. I'm honored by your presence, and thank you so much for your time today.
Thank you very much for inviting me. I appreciate it.
Thank you.
Good. Thank you.
Gentlemen.